our diabetic management. Again, I want to ask everyone, what is your basic function? Ah,
Then help the nurses for the ADL,
to support
and
and
help to assist, to support and assist your nurses or doctors for ADL.
okay. So your basic function is to assist, and support nurses in your providing or performing ADL to your patients. So what are the ADL? What is ADL? In a chorus again. I don't want chorus. I want to sing alone. Activities of daily living. You have to remember that. That is your basic function. Whenever you go for your interview, whenever you put in your CV, you better put the basic function because the employer is looking after this. Okay? They want to know what exactly you are supposed to do. So in ADL, what does it include? What do you perform in your activities of patients' daily living?
Feeding.
Okay, only those?
Mobility.
Mobility what? Mobility is moving. There must be something together with mobility. If you will tell your employer, mobility ma'am. So they will ask of you to put more, to add more. Mobility, assisting in mobility devices. Okay, you have to assist. What else? Vital signs measurement or vital signs taking. What else? Tracheostomy care. What else? Okay. If you can check or if you will see your yellow card, it is all written in here. Okay? So you start with your hand hygiene because this is the most important for us to provide or to protect us from infection. Okay? So all of this. So we have hand hygiene, we have the vital signs, body mechanics, transferring. When we say body mechanics, it includes transferring, positioning, lifting, and carrying of patients. What else? Grooming and hygiene, bathing. What else? Nutrition, feeding, inserting NGT tube. What else? Colostomy care, simple wound dressing. And now we will be doing diabetic management. So for ADL, actually, diabetic management is not included. So because most of our patients, especially when you are going to be assigned it at home as a home care assistant or a home care caregiver, so you will be doing all of this. And most patient in the home care is having diabetes. So even it is not included in ADL because we are not supposed to give injection. You should remember that we are not supposed to give injection. But since our patients are more of the chronic ones, they have diabetic cases or diabetic problem, we better sure that we know how to take care of them. Okay? So one thing for sure, we are only giving injection by what route? Which means by way of what? Only one.
Subcutaneous.
Subcutaneous. You should remember that. There is no other injection site that you will be doing. Okay? Subcutaneous, by the tissue, by the belly fats, most especially in the belly. Okay? In the most fatty surface of our body. But mostly on the belly side. Okay? Subcutaneous. Now, what is diabetes? You are interacting with them, they are asking so many things. Why? Why I have diabetes? What is diabetes, ma'am? You answer, you have to give a complete answer to your patient. Because otherwise, your patient will ask and ask and ask. Incomplete answer will make your patient ask for more. Get your Google.
Diabetes is a condition whereby the pancreas is not able to produce enough insulin.
And what causes when the pancreas is not producing enough insulin?
Cannot break down glucose.
Cannot break down glucose. And what will be the outcome? What should be the result?
The blood sugar is too high.
Blood sugar will become high. And that will be, what is our medical term? High blood sugar in a... Hyperglycemia. You should remember, hyper is always high. Prefix before a word, hyper means high. And glycemia is a glucose, so it is high glucose level. Okay, so it is right. Diabetes is a chronic disease. Means to say it is not only now. Chronic means it's been a long time disease. Okay? It's been more than 3 months, a year or more. So diabetes is a chronic disease that characterized by the pancreas, which is not producing enough insulin, that causes hyperglycemia or high blood sugar. So what do we know? What is the medical term if it is low blood sugar?
Hypoglycemia.
Hypoglycemia. Okay. In this hypoglycemia or hyperglycemia, we have symptoms or signs that we can see the patient. What are those signs? What are the signs we will know that the patient is having hyperglycemia or diabetes? Okay, Sandra.
We have polyuria,
Okay.
which means too much urinating.
Okay.
Then we have polydipsia, which means too much sweating.
Okay.
Then we have
Wait.
polyphagia,
Dipsia is what? Thirsty.
and then polyphagia, which means too much hunger.
Okay, so we have three P's to describe the signs of diabetes. Polyphagia means what? Frequent or eating more, hungry, always hungry. Okay? Phagia. Polyuria, frequent urination. Okay, the other one, polydipsia.
Increase in thirst.
Okay, so person is thirsty. So there are three. So you might observe those with your friends or families or anybody. Okay, so if you observe, so you better watch out and take care of your, take the blood sugar test or just to observe the patient, the family member. What about the other signs and symptoms of diabetic mellitus?
Less healing wound. Yes, no? Less healing wound.
Weight loss.
Okay. Weight loss. What else? Slow healing of wound. Skin problem. What is that for the female? Yeast infection for female. What else? Numbness or tingling of feet and the hands. What else? One more. Loss of weight. Did I mention loss of weight?
Yes, no.
Loss of weight, slow healing of wound, yeast infection for female, numbness, tingling of feet and fingers. What else? Skin problems. Those vision changes is in the long run. Okay, we are just talking about what you can see to a patient, a symptom or a sign that a patient might have diabetes. What else? There are 6. Slow healing of wound. Did I? Okay, so there are 6. Yeast infection, slow healing, loss of weight, that is a skin problem. What else? Numbness and tingling, and fatigue. Okay, so there are 6 more. So there are types of diabetes. So we should know what are the types of diabetes. Diabetes is diabetes mellitus, or abbreviated as DM. Okay? So most of the patients, they will just tell you, or the doctor tell you, that patient has DM. Diabetes mellitus. Okay, there are types, 3 types of diabetes mellitus. What are those?
Type 1, type 2.
Okay, so we have to describe what goes with type 1.
Can develop at any age.
Okay, yeah. Very good, because you have the note. Keep it in your mind. That note will just go. Okay? So if that note is not with you now, how do you say it? 1, type 1. Just a month ago, right? You have taken that diabetes. Yes, 1 month ago. Type 1. So it starts from childhood to adolescence. Okay, childhood means like when the patient just get born, or when the patient is already in the childhood days, childhood years, maybe until 12. Second is type 2, wherein adult to elderly. So type 2 comprises 90% of diabetes. Okay? Type 2, most of the people are in the type 2 category. Type 3 is
For mother and baby.
I'm not asking for mother and baby. I need the term for the type 3. What is the type 3 diabetes? Gestational diabetes, or GD. GDM, gestational diabetes mellitus. Means to say, during the time the mother is pregnant, so once the baby is delivered or the mother delivered, the diabetes will be gone. But in the later year of life, either the mother or the baby can have. It will come back. Not all, but most of the patients with GDM has in later life. Okay? Maybe around 3, 4, 5 years, it will come back. Okay? So we have three types of diabetes. So we know now. Now, we want to know what are the management of diabetes, how we can manage our patients with diabetes mellitus. We are going to the patient, and we want to manage patient with diabetes, or how do we take care of patients with diabetes? How do we take care of them? So we are going to take care of them, but how?
For food also, avoiding food, ma'am.
Huh?
For the food also, ma'am. No, less fat and salt and sugar. We're giving the patient food.
So you are now a nutritionist. So you say you are going to cancel this sugar, cancel this fat, remove this from the patient's diet. Okay, one. So we need to provide good, healthy foods. Good, healthy foods means whatever. Like for example, the patient went to the doctor. So the doctor referred the patient to the nutritionist or dietitian. So then, the diet of the patient will be evaluated, will be assessed. What is going to be the patient's food for the day? Like for example, this day, it should be according to the weight of the patient. It should be 1,200 calories per day. So according to that, the nutritionist will develop a diet according to the weight of the patient. So only 1,002. So you as the nursing aide or the nurses will be the one to monitor. Today, si Baba had 500 already in the morning. So what left is 700 more, right? So that you have to check the patient whether the patient is going to take less or more. Okay? Less is good. More is not good. Okay? That's why the patients with diabetes, the nutritionist and doctor, so with you, you are collaborating with each other to provide the patient good nutrition. Okay? So healthy food, number one, healthy lifestyle, and healthy living. Number two, physical exercise. So we have to give or help the patient to move. Because the more movement the patient have, the more burning of the calories. So what the patient has eaten will be burned by doing exercises. So if your patient is active, like patient can move, so you have to allow at least in your plan 15 minutes for exercise. Take your patient, go around, walk around the unit. Okay? If you are at home, so take the patient out. Maybe just give 15 minutes to walk around. Okay? Physical exercise. But if your patient is on the bed, what you can do is to provide them or help them with passive exercise. Passive exercise means you are the one doing exercises for the patient. Passive, doing for the patient. Okay? Active, patient does it alone. Remember that. Okay? Active and passive exercise. Most of your patients at home, they will be in bed. So what you can do is, you have to give them passive exercise. Take their arm, take their leg. If there is a physiotherapy, fine. But if there is no physiotherapist, that will be your work or job to do. Okay? 3, nutritional assessment. Providing nutritional assessment. As we talk about providing healthy lifestyle, that nutritional assessment means you have to monitor the food intake. Whatever food the patient is supposed to eat, that you provide. Maybe the patient or the family will come, bring that patient a cake. Okay. Only once. One time only, the patient will take the cake. Okay? And you check your blood sugar later. Okay? So, that will be your fault. You did not check your patient. Okay, so nutritional assessment. And number 4 is administration of oral diabetic, anti-diabetic medication and insulin injection. Okay, the last one is glucometer testing. Okay, so we have 5. We need to manage our patient with diabetes with those management that we need to do for our patient. Okay, we have 5. Okay, now, so as what I said, after all of this, we need to check our patient's blood sugar. So as one of those management of diabetes is daily glucometer testing. So there are 2 ways of testing glucometer. One is by glucometer testing, and the other one is by drawing a blood. So means to say, patient is going to the center, to the hospital, to the doctor, and the doctor will advise the patient to have blood test by drawing of blood. Okay? So there are 2 ways. One is glucometer testing, and the other one is drawing of blood for the lab. Now, what are the medical equipment that we need that we will be using for our glucometer testing? So everybody does have now, right? Take it with you. Take it out. So we have in this kit, in a glucometer kit, we have, this is a glucometer device. Okay? It's a small device. When we say device, either it will be for the treatment or diagnosis of the patient. So this one is for diagnosing, to check, okay? But for even, it can be treatment because according to the result, we will give our insulin. Okay? So we have the glucometer test strips. So you have it all with you, right? Okay. So we will just put it like this. Okay? So if everybody does the same, so we have that part down of this where we can put the blood. Okay? The other half that will be higher, it will be inserted, that will be with the chip. Okay? Just insert it, not fully. Just leave it like that. Set it aside. We have this one, what we call it, lancing pen. Okay? It's a lancing pen. So we will be using lancet. Lancet is the needle. We call it lancet, lancing pen. Okay? If you have the same way like this, there is a square part of this. So we have to push it inside. Okay? So follow after me if you have one. Wait a minute. So we have to twist our, everybody has the same lancing pen? Okay. So you have to twist it and out. Now insert the lancing pen according to this shape. Okay, push it and wait for the click. There is always click that you will hear. Okay? Twist it again. Slowly take out the round thing. Set it aside. Now you have to put this back. Back must be clicking. Okay, click. Okay, you should always hear the click. Otherwise, when you prick the finger, it will be loose. Okay, so always listen to the click. Now, regulate, there is a regulator or the numbers that you can see. There is 1 to 5, or the others, there are up to 7. So one number, if you will set it to 1, 1 means for the babies. Okay? So go with the second, 2, that will be for children. Those skin which are soft. Okay? Go with the 3, 4, 5, 6, 7. That will be for the adult. And the 7, only for those who have the hard finger pads. Okay? So better 3 and 4 for the adult is good. Okay? Set it to 4 or 3. Okay? Now, once it is set, you have to pull this. It is not click well. Okay, pull this upper part or the tip here. You will hear the click the same. Okay, click. Now check it. As we said in our universal protocol, whatever we use to our patient, we need to check for working. We should not use this if we did not check if this is going to function well. So how to check? Once we pull this, you have to press this thing. You heard that? You heard the click? Okay. Go back means to say it's working, right? So go back again and it is set. Ready now. Now let's go with our glucometer. Keep it ready. Halfway, insert the glucometer strips. We will be using alcohol pad or spirit swab or alcohol swab. Okay? Does everyone have? Get a partner. So each one have a partner. We will do it. Asan na yung sa'yo?
Wala kami yan.
Bakit wala kayo niyan?
Swab kasama. Swab.
Itong gamitin mo ma'am.
Thank you, ma'am.
One by one, for the partner. Use it for your partner. Distribute it there. Kalit ba Catherine? Ikaw ang gagawin ko.
One by one. Si parang diabetic.
Okay. You have it or no? Okay, any more? Okay, grab your partner and we will do it. Partner, si Kuya Ed. Tinatanong ko kayo kanina if everyone has the same.
Ito na lang po yung gamitin namin sa kanya.
O sige muna. Oo, mamaya.
Tapos yung isdariyan. Tapos kami strips po.
You know the person you are going to take, so PPE or the glove is not necessary. So, this is appropriate PPE. Okay? If you are going to use the glove and the same thing you are going to use that glove to another one, so it's useless. Okay? Glove is to be used every patient. Not you will be using, that's why in phlebotomy room, this is always I'm saying, remove your glove. Because you have already used that and you will use it to me. So where is the infection control?
Nag-test na siya.
Tama ba yung pagkuhan? Okay. Now, everyone is ready? Okay, ready? When we take, listen, the principles that we need to know when taking blood sugar is we have to choose the finger pad. Okay? Finger pad. Ito yon. But we will be pricking on the side. Not on the pad, but on the side. Got me? Okay? It's not on the pad. On the sides. Okay? So we will aim our lancets to the sides. Okay? So get your swab, choose, ask your patient which side you will be taking. Either of these three, for the babies is on the sole. Okay? Sole. I did say sole. Ano yun? Yung pinakabu... Ano yung ganon? Anong tawag doon? Hindi talampakay. Sako. Ano ba sako sa English? Sole. The sole of the feet. Ano ba yun? The heel of the feet. Sorry. Babies will be at the heel of the feet. Children and adults will be here. So when you are taking the blood sugar, every day you have to check. Today here, tomorrow here. Next day here, the next day here. You should not do it same day, same finger. Okay, done? Okay, now, before we prick, we have to make sure our strip is already inserted. Okay? Because longer time of inserting this and longer time you provide a drop of blood, it will take an error. Okay? Another error, if you are going to use this and the blood is spread under, it will cause error. Another thing, if the blood is not enough, when you put in this enough space, error. There are lots of errors. Okay? And if you will have error, this is 3 dirhams. Okay? This is 3 dirhams. This is only, needle is 150. But the strip is 3. Okay? That's why be very careful. When the drop of blood, when you prick, okay, I will just show you, don't prick yet. So take it off, always take off or cut the swab in the middle. Find your spot. So swab it circular. Anything that you swab should go circular. Okay? So once you swab it, get your prepared lancet and aim. Aim means to say it is not with a distance. You should keep it close or it's already on that pad. Okay? Side of the pad. Okay? Once you are to that side, but before that, you have to squeeze a little bit. Okay? So squeeze. Don't remove your finger like that. Just squeeze carefully, gently. Once you see there is a little like redness, that's the time aim with your lancet and prick. Okay? Once it prick, you inserted already. Once you inserted this, okay? Pag nag-error kayo ha, it's not my fault. So, when it doesn't matter whether write it or no. Listen, you will see a drop. Drop. I did not say the blood is spread. When you see that there is a drop of blood comes out, after you prick it, that's the time aim to the base. Okay? So that to prevent it from spreading under. Once it is spread, it will come as error. Okay? So preventing error. We don't want to have error. Okay? 92. What is the normal blood sugar?
140 less
Ano yung sinabi mo?
less 140 milligram deciliter per deciliter or wrong.
Ewan ko sa'yo kung ano yung pinag-aralan mo.
140 less.
Ha? What is the normal blood sugar of an adult? Of a human body?
70 to 130.
Saan mo kinuha yung Rose?
95 to 110 mo.
70 to 120.
95 to 110 mo. Hindi na hula, di matandaan. Sorry. Di matandaan.
Okay, it's 80 to 120 or 4 to 6 milligram per DL. Oh, sorry. 80 to 120 milligram per DL or 4 to 6 millimeter per... Wait, I'm lost. So if it is MOL, millimeter per deciliter, DCL, something.
MS ma'am, DL.
Okay, that will be times 18, so you will go back to 80 to 120. Okay, now, let's do it. Okay? I'm not going to see everybody, but I hope everybody is doing well.
Ma'am, I'm doing this. Or no?
Okay. So, ready? Squeeze it. You do not take the drop of blood if you did not see the dropping of blood in the screen. Okay? It will come as wrong.
Pag wrong, ulit again.
Ay, anong magagawa natin? Okay, there is a drop of blood. So, get it?
Give a space like that. Like the right part.
And hold your swab. Asan yung swab ko, darling? Wow!
Magkano ma'am? 73?
Wow, very, very good ka naman. Kumain ka ba?
Hindi pa.
Kaya naman ka na. So, 80 to 120. So, she got 73. Gutom ka pa ba? Okay. So, when disposing this, okay. So, once you take the drop of blood, you better keep it in your other finger. Okay? So, once the drop is out, so, automatically, so press it with your swab. Okay? To prevent it from bleeding.
Because I ate lunch.
Very good ka. So, take out like this. Okay? And dispose it to the medical waste. Okay. Done? Everybody done? Ah? Okay. Huwag nakaturo yung mga needle mo. Always do like that.
Ma'am, first time.
That's why I ate lunch.
Ma'am, for the first time, okay. Just wait.
So get it to the other side. Taken without like you are eating,
Random?
you ate a while ago, you maybe 2 hours, that is called random. But you have to see whether if random, if you are really normal, means to say you are normal, even as you age. But if you fast, fasting blood sugar is 6 to 8 hours up to 12. So if you fast, means to say your blood sugar, your blood is already concentrated. And that is the best result after fasting. This one, we cannot say because you ate or maybe you ate 2 hours, you ate too much. But anyway, as long as you're normal, your glucose is normal, even how you ate too much, it will be within normal. 6 to 8, 1 to 12.
For you now,
Have a fasting blood sugar, or the one that we have done now is random. Okay, we call it RBS or random blood sugar. So the one that we are taking like randomly is without the time. Means to say before you eat, after you eat, 1 hour, 2 hours, 3 hours. So it doesn't matter, it's random. We want to know the level of our blood sugar. So if we want like one of you or some of you, you have like your blood sugar now is more than 150. Anybody? Okay. Huh?
170.
Okay, 170.
17.
17, okay. What I mean, over 120, 150, 180. Okay, so those, what we can advise you, if your patient will be the same as like that, what you need to do is keep your patient fasted. Fasting means no water, no food. Okay? We will do it to check whether that blood sugar is really that high or the patient is consistently diabetic. So we need to let the patient fast, or you yourselves, whoever does the 178 or 150 and more. So fast from tonight, 6 to 8 hours or 12 maximum. Okay? And in the morning, you check your blood sugar as in nothing you have taken. Okay? So you will know your baseline. Whether you are going to be having later in life, you are going to have in the future, or you are normal. Okay? So that way, you need to know whether you are going to have your future or without. Okay, now, if our patient has a high blood sugar, so what we need to do is, the needles that you have, the needles that you use, okay, we will dispose that needle in a sharps container. Sharps container, huh? I'm talking about sharps container. Do you know the sharps container? Okay. If you are working at home, if you will be working at home, the empty bottle of water, so use that one, put in your sharp or the needle, and close it and dispose. Okay, if you are at home. Because some of the provider, like insurance, like the MAN, previously they are providing for patients with diabetes at home. Sharps container, the small one. But nowadays, so they are not giving that. So better for you to prevent you to prick, accidental prick. Okay? If the patient has hepatitis B, you better be careful. Okay? So, you at home, if you are going to have that, so dispose it in a empty water bottle. But if you are in a healthcare, we have all the sharps container. Do you know where you can find your sharps container in a healthcare? Huh? You don't know where you can find. Whenever you come to the healthcare, you have to be observant. Okay? So that when you come to work there, you know exactly where you will find the sharps. Sharps, you will find it always on the tables. You will not find the sharps down on the floor. Okay? To avoid, especially for those children walking around in the healthcare facility, so to provide them from, so checking, babies, children, they are so curious. So they want to see what is that, yellow color. Okay? So in a healthcare, most of those are wall mounted. We are putting it on the wall. Wall at the eye level, so that it will not be taken by those children. Okay? Or if you have the emergency trolley or the medication cart, it is on top of the table. Okay? So you will find it there. But the medical waste, always find it together with the domestic waste or the general waste. The yellow bag, the yellow bin, down on the floor. Okay. Now, this patient who has diabetes is going for insulin injection. What we have is pre-filled insulin syringe. This is usually you will find in a home or in the hospital or healthcare facility with insulin patients, with patient receiving insulin. So this is a pre-filled insulin. Actually, this one is like this. It is full. It is 300 units. So you will find it inside the ref. So it is kept, stored in a medical refrigerator in a hospital or healthcare. Medical refrigerator because this one is medicine. Second, there is a thermometer or temperature regulated refrigerator. So, not like the same at home. At home is only 23, right? So, our medical refrigerator, there is a thermometer you can set. If it is, the manufacturer said, -4, -8, so you can set it with a hygrometer. Okay? So that medical refrigerator, for everybody's knowledge, information, is being checked every shift. If there are 2 shifts, one in the morning, one in the night, we have to check the temperature. Why? Because we want to know that this medicine put inside, kept inside, stored inside, is effective or potent. Means, can give you effective result, treatment. Okay? If it will be out of that range of thermometer range, so you are not going to give your medicine. Okay? But at home, 23 is our regulated temperature. So at home, you can find this on the side of the egg tray. You know where is the egg tray at the door? Okay. So you can place this at the egg tray, on the butter, on that side, or in the middle of that compartment. Not on the freezer, not on the chiller, not on the vegetable side. Okay, got you? From the side with that egg tray, or 1, 2, 3 here in the middle, but not on the freezer, not on the chiller, not on the vegetable space. Okay? So now, we have a pre-filled insulin. What we need is pre-filled, and we have, this is disposable fine needle. Fine means very fine. Okay? So it depends on the size. Gauge. It will be 32, 34, 37. Very fine. Okay? So once we take it out from the rep, keep it 5 to 10 minutes outside. But if the doctor said, now, give that 30 units. So take it out from the rep and you do like this with your palm. Okay? So that it will keep it warm immediately. Okay? So when the doctor said, give now, because that patient needs now. Now means now. So not to wait for 5-10 minutes, now. So that will be like stat dose. Now is stat dose. Okay? So now, it is already here. Get your new disposable needle. This is disposable, means to say one use only. So put it, take out the cap, set aside, get your swab. We will go with the patient. Okay? So we will be giving subcutaneous insulin injection. Means to say, it will be 45 degrees. Either you go this side, you go that side. Okay? It's 45. Check there is our layers of the skin. Is it there? I said layers of the skin. So, the layers of the skin, we have the dermis, epidermis, dermis, and the subcutaneous. Okay? So, means to say, after the skin, the epidermis, dermal is the intradermal, and the subcutaneous. So, either all of these are fats. The third layer of the skin is fats. So, either you do here, you do that way, it's 45. You cannot find the muscle there. Okay? We are only in the fats, tissues. Okay? Grab your swab, circular, find the side. Today here, tomorrow here, the next day here. Not only in one side forever. So this side, belly, circular, hold it with your hand, pinch, insert. Insert using, how do you use your pen? Pen-like. Okay? Insert. Move your right thumb. On the pad, press. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. Out. Okay? Do not massage. Okay? Now, I did not tell you, we will regulate this. How much to give? It depends on the doctor. Never recap, needle should never recap. But for the demonstration, we are recapping. This one, when you get it from the rep, okay, keep it maybe 10 to 15 minutes to keep it warm. Then, regulate it. On this part, you can regulate. This is 300. But doctor said, gave you, okay, the order is 30 units. So, 30 units, regulate from here. There is a number that will come out here. 30, 30. No more, no less. 30. Okay? So, remove, swab, inject, pinch, inject, pad, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, out. Do not massage. So, take this off, the whole thing, and keep it to the sharps container. At home, where to keep? In the empty bottle. Okay? After that, same. So, hand hygiene, go back to the patient, keep the patient comfortable, document, and all of this to the medical waste. Your insulin, back to the rec. Okay? That's all for diabetes. Disposal, the same. Squeeze, take it off. Either,
Hindi siya
no, no, no.
Hindi
Hindi
siya
ba nagpe-press? Either you put this that way, okay, and ayaw siya.
Pull lang po. Pull. Manual. Mahugutin lang. Matutusok.
So, pull it out. Okay, and dispose it. Same, disinfect. This one, move it to the sharps box. Okay then? The previous years, old school, we are using this. This is the insulin. Sinong gumagamit nito?
Ako ma'am sa pasyente ko ma'am.
Ang pasyente mo, napaka-primitive. Wala nang ganito ngayon.
Wala na nga po ma'am. Ano pa 2010 pa yun ma'am?
Kahit na 2010.
Ganyan po gamit sa Tsaka yung ano niya insulin sa bote ma'am.
Yon. The thing is, once you take it from the bottle, the same needle. Same needle, you will inject to the patient. And this is already used. So, it will be done. This is the thing.
Yung bigyan ng family niyo.
Ano?
Buhay pa daw.
Ewan ko, bakit
matagal
ayaw niya kaninang
Ano na kasi siya dahil kinain na lahat ng organ niya ng diabetes.
Ilang taon na yun?
Ang niya umaga tanghali gabi 75.
Ayaw nga eh. Doesn't move. Kahit na. Oh. Ewan ko, kanina I do it.
Pero gumamit din ako ng
Oo.
penta yun ma'am.
Ayaw niya.
Pero gumamit din ako ng penta yun.
Ito?
Ma'am, hindi yung sa pag-insulin.
Ito. You cannot change the needle here. The needle is inserted. Useless. You use it from the bottle, you withdraw, and then same time, so it becomes dull. It's not that sharp anymore. That's why, masakit. Okay? So this one is disposable. Okay. So, inject now. You do not just come with this alone. Keep it here. Get your swab. Okay? And come to the patient. Okay? Same thing. So, yan. Ilagay mo dito with a tray because hindi na siya kasya. It doesn't contain now in that tray, in this. So, get a tray. Okay? Always come with the patient with a kidney basin or with a tray. You do not come like one piece. Okay? So, from the beginning, with the universal protocol,